Based on available data from the Ghana Meteorological Agency, Ghana is experiencing a shift towards warmer temperatures, which is unusual in the context of historical climate patterns. There hasn't been a consistent pattern in rainfall over the years, with evidence of fluctuations in the amount of rain from year to year, but without a clear trend of increase or decrease over the long term.
If you look at the three main climate risks that faces the continent of Africa and Ghana specifically, you find floods, you find droughts, and you find heat. All these three issues have implications. If you look at it from a drought perspective, we have very dry temperatures, great impact, of course, water accessibility. These are all heat stroke, which are all very critical to the country and our public health sectors.
The sudden hot weather is due to several factors, including human-induced climate change, urbanization, and the urban heat island effect. Human activities such as burning fossil fuels, deforestation, and certain agricultural practices contribute to the Earth's warming, leading to changes in weather patterns, rising sea levels, and more extreme weather events. Climate-related disasters such as floods and droughts pose additional health risks to communities across Ghana. Floodwaters can contaminate water sources, leading to outbreaks of waterborne diseases like cholera and typhoid. Gertrude from Mepe is a survivor of the Twin Dam spillage.
The whole thing, I for instance will never forget, because I had an experience, a traumatic one at that. And I know most victims as well will find it hard to forget the whole incident.
One of the most tangible effects of climate change on public health in Ghana is the increased transmission of vector-borne diseases such as malaria and dengue fever.
We are cutting down trees, we are creating the environment that will make the temperatures rise. So you see that the conditions that are acceptable for the bugs or the vectors becomes more and more feasible.
Feel uneasy when the sun is scorching. You see, I can't breathe, I can't even, my whole body. Oh, why, God?
Heat na ready. Pa yintumenda. O shedemu a. O so fine no cry. O ntimpo se wa so fine. Ma heat bebre. I use the umbrella to cover my child.
Now, as temperatures continue to soar, another concerning health issue emerges: the impact of heat on mental health. Studies have shown that prolonged exposure to heat temperatures can exacerbate stress, anxiety, and aggression, leading to a spike in mental health-related incidents.
Clinical psychologist at the Accra Psychiatric Hospital, Dr. E.A. Azu, says mental health can be impacted by climate change.
When we talk about heat exhaustion, just by the mere fact that the temperature has gone higher makes you easily fatigued and you get exhausted from that. And then heat stroke is also another manifestation. When there is a higher temperature, the blood vessels get dilated. So the blood vessels, which are like a water hose where water is passing, in the presence of the heat, they widen up. And because they have widened up, it is likely for there to be a oozing of the blood. And once there is a oozing of the blood and the blood goes out of its channel, then you can get a stroke from that. And that is how heat stroke would come about. But you would notice somebody who is not hypertensive, who is not diabetic, who is not known to have any chronic condition, but is sit much and the person is doing about his normal duty. It's a physically fit soldier, going about his normal duty, but all of a sudden falls down, collapse, you rush to the hospital and the person is dead.
Despite the challenges posed by climate change, Ghana is taking proactive steps to adapt and build resilience in the health sector. From early warning systems for disease outbreaks to climate-resistant healthcare facilities, innovative initiatives are emerging to safeguard public health in a changing climate.
Advocacy and policies and strong sort of regulations around open burning will become very important for the country to look at. Transport is one of the sectors that contributes to air pollution, and combining that with climate is not a very good combination. So really making sure that the transport sector can be cleaner and we can have strong policies supporting the transport sector will be good. Of course, promoting using bicycles and other means of transport.
As Ghana continues to grapple with the effects of climate change on public health, it is clear that urgent action is needed to protect vulnerable communities and build resilience in the face of environmental challenges. By raising awareness, promoting adaptation measures, and fostering collaborations across sectors, we can work together towards a healthier, more resilient future for all Ghanaians. Emmanuel Samani, TV3 News.